Welcome to the Plain English Public Health Weekly Report. My name is Richard Greenland, and today is July 10th, 2020. As always, we will start with the COVID-19 statistics. Worldwide, we have more than 12.6 million cases now, as well as over 560,000 deaths. In the United States alone, we have nearly 3.3 million cases, as well as over 136,000 deaths. This week, we have another recall on hand sanitizers. Once again, it's because of methanol. I've added the specific brands to the screen, but you can get more information by clicking on the link down below the video. To make it short, just don't use hand sanitizers that have methanol in them. Methanol is very toxic to humans. We just should not use it. Basically right now, because of the pandemic, we're seeing a lot of different companies, some that are not the most ethical, jumping into the hand sanitizer market. And, basically they're making these things that are cheap but not safe. So to be safe, only use hand sanitizer brands that you're familiar with or that you've heard, are good. Try not to use, off brands that you've never heard of and no one around you has ever heard of, because, the chances are higher that it has some type of ingredient that's not good in it. I'd like to talk a little bit right now about face masks. We talked a lot about face masks last week, but there have been a few things that have come up in opposition to face masks and some of the things we said last week. And so I'd like to address those things. One of the big arguments is that face masks are not effective, like we mentioned last week. And one of the arguments towards that is that the virus is so small that it can fit through any of the microscopic holes that are in masks. Basically saying that masks are not effective because they can't block something that small. And when comparing the size of the virus to the size of the holes, it's true, most masks wouldn't be able to block that normally. But there are some reasons why they're still effective, even with that bit of information. There's at least three reasons. First off, effective masks have more than one layer of material. Typically 3 is the minimum layers. And so the layers will not line up perfectly on a microscopic level. And so even though there may be holes in one layer, if you have 3 or more layers, typically at least one of those layers will be in the way of any of the holes in the other layers. The more layers, the more likely it is to block things. Also, viruses, you don't just get the virus, you don't get, for example, COVID-19 or any virus really, just by getting one virus particle in you. You have to get what's called a virus load, meaning a certain critical number of virus particles for your body to actually respond or to be threatened by it at all. And so, even if some of those particles would get through, since it's not perfect, the layering isn't perfect, and so some particles will get through, you're still typically not going to get sick if you're wearing a mask, and you're not going to make other people sick either, because you're not going to have enough of that virus load go to you or to someone else. A second reason why masks are still effective is that the main way that COVID-19 is spread from person to person is through water droplets. We release water droplets when we cough, when we sneeze, when we breathe even when we talk to people. We're releasing these water droplets constantly. And they are varying sizes. Some are much larger, some are much smaller. But generally speaking, these water droplets are of a size that are large enough for masks to block. There is some debate about how much is spread, how much of the virus is spread through aerosols, which basically means just teeny tiny particles. And during coughing and sneezing, you can produce some aerosols, and those may be able to get through masks. But like I said, there is still a lot of debate on that, but the general consensus right now is that the majority of virus transmission occurs because of these larger water droplets. And like I said, even if some of the aerosol stuff does get through, it's still going to be a lower number of virus particles than what you would typically need to get sick. So third, studies done on face masks show that they are effective at stopping the spread. Regardless of what should happen based on size calculations and whatever else, whatever other arguments you want to bring up, the studies show that the results are masks work. So, I mean, we don't know why, at least not all of the whys. We know some of them, like the ones I just mentioned, but we don't know all the whys of why masks work. But we do know that they do work. It's definitive. We've got enough studies in there that show that they do work. We know that they're not 100% perfect, but they do work tremendously well in reducing the amount of virus that gets out to people and the amount of spread that there is, the transmission of the virus. So even though scientists won't be fully satisfied until they find out exactly why masks work as well as they do, for now, we need to just follow the recommendations. Masks do work. We need to use them in order to stop the spread of the virus. It's basically that simple. I've included some additional links below the video about masks and other things about them, things we've kind of talked about and some things we haven't. But just general information about masks, I've included that in the video, in the description below the video for anyone who happens to be interested in that. University of Utah researchers have found that COVID-19 can affect the platelets in our blood. The platelets are typically the small things that that cause clots. So, for example, if we get a scratch on our arm, the platelets will go there and they'll create a scab. Same thing, platelets, if they get out of control, they can build up in our arteries, cause blockages. We can have heart attacks or strokes if it's in our brain, things like that. And so COVID-19 tends to cause platelets to clump together more. This causes more clots, and that's why we're seeing a lot of these COVID-19 cases actually develop into heart attacks, strokes, and other circulatory system type of diseases. The more we learn about COVID-19, it seems the more dangerous it seems to be. When we first learned about COVID-19, we basically thought, okay, it's a respiratory disease. That's dangerous in and of itself because SARS and MERS were also respiratory diseases, but we didn't think it would be terrible. We thought, well, we can probably get this under control pretty easily. Unfortunately, now we know that COVID-19 also directly affects the heart, the lungs, the kidneys, the blood, and it causes inflammation generally throughout your body, which can indirectly affect many other organs. So it's definitely not a good virus. It's not an easy virus to beat. Like we mentioned last week, anyone that thinks that COVID-19 is not dangerous just because the death rate isn't very high, just isn't following the news, isn't paying attention to what the scientists are discovering about this virus. Speaking of the death rate, over the last couple of weeks, we've been seeing fewer deaths than before. Some people took this to mean that the virus was becoming weaker. In fact, some doctors, one specifically I read about in Italy, said that they believed that the virus would become weaker and would just die out on its own. Now, most public health experts, though, believe that that's not the case. We've realized that the lower death rate is not because the virus itself is becoming weaker, but because of a number of other things. One, treatment options are better. We've found a few drugs that help to reduce the severity and the duration of the COVID-19 symptoms. We've been able to help flatten the curve by following some of the CDC guidelines, and so hospitals aren't as overwhelmed anymore. And the most vulnerable among us, the older individuals and also those that have immune diseases or things like that, they tend to be the ones taking it the most seriously, and so they're doing what they can to avoid situations where they would get COVID-19. The last couple of weeks, the surges that we've been seeing have mostly been in individuals that are between 20 to 40 years old. Those that believe that they're not, going to be very susceptible to COVID-19 or to the severe symptoms. And so that's what we're seeing the increase of. The older population hasn't seen a really huge increase. Toward the end of this week, however, we've seen reports coming in from different intensive care units in different hospitals across the nation that they are getting closer to full capacity because of the surges. People are becoming hospitalized because of this. It's not just that they're having an increase in cases, they're having an increase in hospitalizations also. And once we started receiving reports of the ICUs starting to fill up, the death rates have also started to spike back up again. So it's not that the virus is getting weaker at all. It's just that we were able to manage it better, but now that we're being overwhelmed a little bit again, we're starting to see those death rates spike up again. So the whole reason that we had lockdowns, stay-at-home orders, whatever you want to call them, towards the beginning of the pandemic, was to flatten the curve. It was in order for our hospitals to be able to handle, the influx of patients, and to have it happen slowly enough that fewer people would die. Unfortunately, a lot of people are not following the guidelines now. We did a decent job. We saw it go down. States started reopening, and now we're seeing that reopening probably wasn't the best idea. Or even if reopening was okay, the other guidelines like wearing masks and things like that have not been followed as they should. Most experts agree that we probably do not need to go back into a lockdown as long as we follow those guidelines. But many experts also say that they're not seeing that compliance there, and so they think that we may be facing another lockdown or stay-at-home order in many areas across the United States in the near future. In fact, some states are already rolling back partially their reopenings. For example, a lot of bars, nightclubs, and other things like that, where there's a lot of social interaction and less of a chance that you can social distance. Those kind of places are being shut down again in many states, and also a lot of states and cities are starting to require face masks. For the rest of this report, I'd like to focus on a topic that's been a bit controversial this past week. Between different political parties, between scientists and politicians, things like that. It's been rather controversial. That is reopening schools in the fall. We're talking about K through 12 schools. Colleges is another topic altogether we're not going to talk about today, but just opening K through 12 schools. The reason this is controversial is because there are two good things here that we're trying to do, but they seem to be polar opposites of each other. The first thing is that kids need to learn. Some kids have done great being homeschooled or using the online learning that their schools have provided for them during this time, but a lot of kids have not. Sometimes that's just because parents haven't been able to homeschool, and maybe the school hasn't been the greatest at using the online resources, or just didn't do anything at all. Other times it's because of the way that the child learns. Some children just need more interaction, while others do well with just watching a video or reading a book or other things like that. And sometimes it's the situation. It could be the home situation, family situation, economic situation of the child. Any of those can affect the quality of learning that goes on at home. And so we need to find a way to teach all children in a way that they can learn. And public schools public and private schools are part of that solution. The second good thing to do, though, that is kind of the opposite of getting back into school for learning, is that we need to protect people from COVID-19, and that includes practicing social distancing as much as possible. Doing that at school, especially among younger children, is very difficult. Younger children are terrible at social distancing. They love being close to each other. They love touching, each other's faces or holding hands or anything like that. They love the physical connection. And so it's very difficult to do social distancing in a school setting. So what is the answer? Well, we here at Plain English Public Health realize that each state and even each individual school district is experiencing something a little bit different than everyone else. Different situations, different makeup of the student body, different levels of COVID-19 cases and deaths and everything in their community. And so Because of those differences, we believe that individual school districts should have the final say in whether they open up or whether they stay closed, and also if they do open up, what exactly they do in order to protect the children and teachers. We do believe that most schools throughout the U.S. should be able to open up safely as long as they follow certain guidelines. Now, the CDC has put out their own set of guidelines. There's a lot of different guidelines that they've put out, and earlier in the week, Vice President Pence actually said that they were going to change it, and President Trump called on them to change their guidelines. The CDC has since said that they will not change their guidelines, but they will release more information for, in order to help schools better implement those guidelines. More examples, more guidance, things like that. Those guidelines, like I said, there's a lot of them, but they include things like staggering schedules, especially of when children arrive at school, having smaller classes, enforcing hygiene such as hand washing, and wearing face masks while at school. These guidelines would increase the cost and effort for each school. It's not going to be, just a simple walk in the park or anything like that to get these things enacted. But it would definitely reduce the risk of getting infected with COVID-19. People who are against following the guidelines often use the reasoning that children tend to not get hit as hard by COVID-19 as adults do. While that is partially true, they ignore the fact that children do still get sick, and they also ignore the fact that children can be carriers. First off, children get sick. We're seeing that evidence of that even more now. At the beginning of the pandemic, schools were some of the first things to close down, and so children were effectively removed from the public where they could get sick, and so the numbers of children getting sick were made artificially low. Since then, since some of the states have started reopening, schools in most areas of the United States have been out for the summer. And so, again, children haven't been in school. Most of the activities they have during the summer are either outside or with smaller groups of friends, not packed into a building with a ton of different kids. And so that's again a less chance, lower risk of getting COVID-19. They're able to do a little bit better at social distancing in those situations. And then right now, we've started to see some summer camps. As states have opened up, they've allowed summer camps. And these summer camps, they're similar to schools in that children interact a lot with a lot of different children, but they're not quite the same because summer camps typically have a lot more outside activities. Typically with COVID-19, you're more likely to get it if you're inside, just because the water droplets, even the aerosols, all that stuff tends to hang in the air a little bit when you're inside more, and when you're outside, the wind can blow it away, things like that. So with the increase of cases, we've seen in the summer camps an increase of cases of COVID-19, even with them being outside a lot. And so we can expect that once kids go back to school, where they're in that more enclosed environment with even more kids, chances are, if they do not practice the social distancing and follow the other guidelines that the CDC has given us, there will be an increase in the number of cases of COVID-19. It's almost inevitable. Like I mentioned earlier, kids can also be carriers of the disease. Even if they're asymptomatic, they can still give the disease to other people. So they could be going home and giving it to their parents, giving it to their grandparents, or even at school they could be giving it to their teachers. That's a big concern because in the United States, 29% of all teachers in K through 12 are in a high-risk group, meaning 50 years old or older. So that's over a quarter, nearly a third of U.S. teachers who would be in a high-risk group for getting COVID-19. And of course, if the teachers get sick, that'll adversely affect the schooling of the children. So it will be difficult to enact these guidelines that the CDC has for reopening schools, but something needs to be done. It can't just be that you reopen and don't have any guidelines at all, and you just kind of go back to how it was before COVID-19. That just isn't going to work. Again, we do believe that it should be up to the individual school districts to decide how far they want to follow the guidelines. They need to find the good balance between, all the guidelines and how much they're able to budget for them, other things like that. But we do hope that each individual school district will take into consideration and have it be the most important thing in their considerations would be the health and safety of the children and the teachers in the schools. Thank you for watching the Plain English Public Health Weekly Report for July 10th, 2020. Again, I'm Richard Greenland, and you have a healthy weekend.